So we are talk about elimination of cervical cancer in Greece. Here I hope the translation is okay. On behalf of the Hellenic Society for Colposcopy and Cervical Pathology, I would like to send my greetings to Ephraim Sinclair, Zvi Vaknin, the organizing committee, and all Israeli colleagues. Personally, I would like to send warm regards to the president of the webinar, my dear friend and also a good friend of my country, Jacob Bernstein, for the honor to participate in this webinar. I wish peace and health to all of you, your families, and the people of Israel. In Greece, we have approximately 500 to 600 cases of cervical cancer per year and 250 deaths. The cancer registry is not fully accomplished, and the data from the incidence and prevalence of cervical cancer in Greece or the therapeutic interventions are based on estimations. You see here that concerning the age 20 to 29, we have 20 cases per year, and concerning the age from 30 to 65, we have approximately 500 cases per year. The Hellenic Society for Colposcopy and Cervical Pathology was founded in 1985 and currently has around 120 members who have been registered after examinations as certified colposcopists. The registration in diagnostic colposcopy is a prerequisite, but for continuing to be a certified member, it is compulsory to attend a recognized by HSCP conference every 3 years. Our society is allied with EFC and IFCPC. In Greece, we align with the World Health Organization 2030 control targets.
Recording in progress.
HSCP officials, in collaboration with the Greek Obstetrics and Gynecology Society, the Greek Society of Clinical Cytology, the Hellenic Cervical Pathology Academic Research Group, and the Hellenic Society of Pathology, have been invited by the National Public Health Organization since 2013 as official advisors and have expressed their views regarding the actions to be taken in the field of issuing guidelines for the cervical cancer screening and triage. These are the guidelines issued by the Greek Society of Gynecology in 2020. Cervical cancer screening should begin when a woman turns the 21st year of age, except in cases of immunosuppressed individuals. For women aged 21 to 30, pap smear, LBC preferably, is recommended every 3 years, and in the age group over 30, co-testing combining cytology and HPV, mRNA, or DNA test is recommended every 3 years. In 2021, the Spiros Doxiadis Screening Program project was announced, focusing first at the level of primary prevention and second at the level of secondary prevention. First, the National Vaccination Program addresses to special and vulnerable groups of the population, children, migrants, and adults, mobile populations, and populations at risk. And concerning the strategic objective 2 for secondary prevention, early detection of high prevalence diseases and the implementation of the national screening program in the general population. Funding of the screening for cervical cancer based on this strategic objective provides receiving a test at a depth of 3 years in 50% of women 21 to 65 years. In our country, unlike most developed countries, there is a steady upward trend in cancer deaths in both men and women. In women, according to unofficial data, only 25 to 30% of Greek women who should have a pap test are tested regularly. The screening program includes preventive actions such as the establishment of preventive approved diagnostic tests for cervical cancer, information and awareness actions. And now, from 2022, we have the screening program guidelines regardless of whether they have been vaccinated or not. For women in the general population from the age of 21, it is recommended to have a pap smear every 3 years. For women in the general population from the age of 30 and for women with HIV from the age of 25, it is recommended to have regular screening with highly reliable laboratory high-risk HPV test, HPV DNA or HPV mRNA, every 5 to 10 years, followed by treatment immediately or as quickly as possible in people diagnosed with abnormalities. Women diagnosed HIV positive should be tested more frequently, every 3 to 5 years. And this is the algorithm. For the screening, there are some specifications, requirements. The test should be FDA approved for 14 HR HPV viruses, and we use the LBC ThinPrep vial. In the event of finding HR HPV types other than 16-18, a cytological evaluation is provided. In the event of finding 16 or 18 HPV types, patient is referred for colposcopy. And now let's talk about the National Vaccination Program. The National Vaccination Program includes vaccination against HPV. Gardasil 4 and Cervarix were introduced in 2007, and Gardasil 9 was introduced in 2017. The 9-valent HPV vaccine is available in our country and is administered mainly by private practitioners, pediatricians, gynecologists, and health centers personnel. HPV vaccination is recommended for boys and girls aged 9 to 11. In case the vaccination is not done at the recommended age, it can be replenished up to the age of 18. The HPV vaccine is fully reimbursed for boys and girls aged 9 to 18, and the limitation in reimbursement does not apply to the groups of increased risk. And this is the group of increased risk persons. Between 2017 and 2021, the average vaccination coverage among girls was estimated at 55% for ages 11 to 18 and 44% for ages 11 to 14. The most common age of vaccination in the year 2017 was 13 years, while in 2021 it was 12 years. During the time period of the COVID-19 pandemic, 20 to 21, there was a downward trend in overall HPV vaccinations among girls. It is noted that the coverage indicators are far from the percentage that the World Health Organization sets as a vaccination goal until the year 2030. So, the cons of the Greek reality. First, we have opportunistic screening. We do not have the system call recall. Cancer registry is not fully accomplished yet. Sometimes pap test is considered by some people, and unfortunately by some doctors, as a catch-all and has become synonymous to a complete gynecological checkup. We have the use of non-approved HPV tests by some laboratories. We also have some problem with triage. That means that the management is not always conducted by a certified colposcopist. We also have obstetrical morbidity after overtreatments. No need to do. And we also have low vaccination coverage. But we also have pros in the Greek reality. Now we have European sources funding for the National Public Health Organization Cervical Cancer Screening Program. We have vaccination coverage, which is raised the last years, covering boys and girls. We use FDA-approved LBC in our country, ThinPrep. Mainly, most of the laboratories use FDA-approved HPV DNA or mRNA assays, and we have the registration in diagnostic colposcopy. Thank you for your attention.